Now is the time. The Center for Health and Hope is passing the torch of leadership. Many people in Africa and India literally look to the center to sustain their health and hope. In many cases, it is a matter of life or death. Vulnerable AIDS orphans depend upon the center to provide school fees, uniforms, and college scholarships. Impoverished grandparents and their orphaned grandchildren seek houses for shelter. Isolated rural people walk miles to medical camps seeking care. Widows with HIV welcome goats and sheep to supplement their income. Sick women and suffering children depend on a free clinic offering medical assistance. Persecuted LGBTQ+ persons find protection from violence and human rights abuses. Stigmatized population groups endangered by HIV turn to AIDS workshops for education. The Center for Health and Hope became a 501c3 nonprofit in January of 2006, but it emerged much earlier from the vision of Dr. Don Messer, a Denver theological educator. In the 1990s, he responded to the worldwide HIV and AIDS pandemic by initiating a movement to battle the disease's stigmatization and marginalization via supporting and advocating for persons infected and affected by the disease. Initially, Messer's work focused on giving lectures, writing books and articles, and sponsoring HIV prevention workshops in Asia, Latin America, Africa, and the USA. His book, Breaking the Conspiracy of Silence, Christian Churches and the Global AIDS Crisis, published 20 years ago in 2004, helped stimulate the creation of the United Methodist Global AIDS Fund in 2005, as well as the Center for Health and Hope in 2006. The center has grown and expanded over time, requiring full-time supervision and management. Fundraising and grant-making requires specialized leadership that understands the center's mission and constituency. Messer served as a volunteer leader of this movement for more than 20 years, along with his wife, Dr. Bonnie Messer. Now Don has requested the board to find a full-time paid replacement. At age 83, he saw a window of opportunity for new visionary leadership while he continued as chair of the board. Fortunately, a person who has a passion for the center as well as impeccable administrative credentials accepted the board's unanimous invitation to serve as executive director. Justin Levy, a 53-year-old Denver native, has led nonprofit and for-profit organizations, primarily focusing on marketing and communications. He earned his BA from the University of the Pacific and an MA in nonprofit management from Regis University in 2021. In 2024, he completed a certificate program from the Colorado Business Committee for the Arts Leadership Cohort, emphasizing advocacy and institutional diversity, equity, and inclusion efforts. Justin's passion for community service began in his 20s as a board member of the Raphael Levy Memorial Foundation, founded by his grandfather and grand-aunt 76 years ago. Since 2020, Justin has served as the foundation's president, overseeing grants in various areas including education, environment, health, and civil rights. As a dedicated volunteer, Justin has contributed his time and expertise to other organizations such as Project Worthmore, Sunshine Home Share Colorado, Family Promise of Greater Denver, Temple Emmanuel, Cherry Creek Corral, as well as the board of the Center for Health and Hope. In 2023, he and his wife, Carrie, a medical doctor, traveled to Kenya and Rwanda with the center to experience firsthand the programs they sponsor. In 2013, the couple established the Dorinda Levy Thanksgiving Fund through Jewish Family Service in memory of Justin's mother. Over the past 11 years, this fund has helped feed approximately 6,600 individuals during the holiday season. I'm honored to work with Dawn and the Center's board to advocate for people infected and affected by HIV and AIDS, Justin shared. Our team is deeply committed to supporting education, prevention, care, and treatment programs for those in need. I couldn't be more thrilled to build on the legacy the center has established over the past many years. Passing the torch could only be a cliche, but in this case, both Dawn and Justin embrace this metaphor, assuring donors and partners around the world that they can continue to look to the Center for Health and Hope. The Center's light of love, care, and compassion will continue to sparkle and will shine even brighter in the future.